Good morning. I'm getting all kinds of pressure placed on me. All right, what I want to talk to you this morning about is our Iowa eHealth project. And this is something that we've been engaged in since, I think it was late 2008, maybe December 2008, January 2009, to that 2008 Healthcare Reform Act that was passed in the Iowa General Assembly. And I'll talk a little bit more about that here in a minute. But certainly after the last two presentations, I think I'm not going too far out on the limb by saying that you probably aren't going to have effective accountable care organizations or medical homes unless you have a foundation in health IT. And that's really what we're trying to build with this effort. And as you see from the slide, this has truly been a public-private partnership from the outset, and we want to make sure that it remains that way. So there you're going to see our vision. Really what we're trying to do is not just focus on medical care, but also focus on population health science, the public health side of things. So we recognize that there's going to be a need for electronic health records, electronic medical records, and sharing of those documents within health systems. But public health needs to be at the table as well, and we need to begin to affect population health, not just for the patients of that facility, but for all Iowans. And that includes things such as our communicable disease registry and also our immunization registry, so that we can keep up to speed on those and so that providers can have access to those two databases as they are providing care to their patients. So you'll see our vision for Iowa eHealth. And I wanted to share with you as well really a quote from Dr. David Blumenthal, who is the current head of the Office of the National Coordinator. And what Dr. Blumenthal says is that at the heart of our health reform efforts is the use of data to reform payment structures and procedures, manage clinical quality, improve efficiency, and drive improvements in public health. So if you listen to the two previous presentations, a lot of the same concepts here resonated with those two previous presentations. And this is really what we're driving at with our Health IT project and efforts. Benefits of Health IT, a lot of the same concepts once again. Improve healthcare quality. If a physician can have at their fingertips real-time information for a patient who is presenting themselves before them, they are going to be able to provide better care to that individual. If they can have at their fingertips electronic health records that tells that person's medical history, their care coordination is going to be much better designed toward treating that patient. Assure patient safety. Again, if a physician or a provider can have access to that individual's allergy history, their current medications, you can't tell me there isn't going to be improved patient safety for that patient. Increased efficiency in healthcare delivery. What we're talking about is really modernizing healthcare workflow within the clinic setting. And with the change in IT, we've got to get that clinic up to speed with how the workflow is going to occur now that the information technology has changed. And finally, again, our population health, public health surveillance, really promoting and protecting the health of Iowans. So as I mentioned, this really stems from the 2008 Healthcare Reform Act, House File 2539. The result of the Affordable Health Care... Did I change? No. Okay. I touched the computer. It didn't say don't touch the computer, just don't close it like that. Okay. I'm making sure I'm following the rules up here. That 2008 Act was really the result of the 2007 summer effort, Affordable Health Care Commission. Our eHealth Advisory Council and Executive Committee were one. I lumped them together, one of 11 councils that were created as a part of that legislation. And I think I've said on a number of occasions that 2008 Iowa Healthcare Reform Act was one of the most comprehensive pieces of healthcare reform legislation to pass within any state that year. And so that was really the initial starter of our efforts with eHealth. It had a corresponding small appropriation of state funds to really get us started. I think it was $180,000 to begin the planning process. But the big catalyst for our efforts around eHealth really was the stimulus package, the American Recovery and Reinvestment Act. And Tom mentioned it earlier. Within that stimulus package, there is a provision, the HITECH Act, which really created some funding streams to expand the use of health IT. One funding stream was focused on state grants. I believe they carved out about $2 billion for state grants. Each state was entitled to some funding to do planning around health IT and how they would build a health information exchange for their state. Iowa will receive $8.375 million over a 4-year period as a result of that. And so that's exciting. As you can see, that's a little bit bigger amount of money than the $180,000 we were originally appropriated to begin doing the planning. So we're excited about that. In addition to the state planning grant provision, there was also a provision in there to create regional extension centers, really consulting entities that can go out and work with providers and help them as they make a transition towards health IT and a transition toward electronic health records. We are fortunate enough in the state of Iowa to receive funding for that. We have a regional extension center within the state. The Iowa Foundation for Medical Care has been submitted an application on behalf of Iowa and was successful in that, and they are working diligently to begin to bring providers up to speed and on board with their efforts. There was also provisions for provider incentives for meaningful use, so that if a provider can demonstrate that they were meaningfully using health IT, and I think the rules regarding meaningful use just came out within the last couple of weeks. As long as they could demonstrate that they were meaningfully using health IT, they would be eligible for Medicaid or Medicare incentives. And certainly that's a driving force for us as a state to get a health information exchange created so that we can allow those providers to meaningfully use health IT across the statewide system. And I know Medicaid and our department have been in close communication as to how they may structure their incentives. And then finally, there were many opportunities within the HITECH Act to expand training for health IT workers. We recognize that across the country, if you're going to have expanded use of electronic health records, you need to have some folks on board who are able to make those connections and do the maintenance that is required as a result of this expanded technology. And so we've had a number of colleges, community colleges, partner on applications within Iowa and across state borders. And I can't give you the exact details, but I know a few of those have been successful. And so we are looking at ways in which we can partner with them from a state planning perspective so that we can ensure that there is a workforce to keep these systems up to date as we move forward with building a health information exchange. As I stated at the outset, this has been a public-private partnership, and we want to keep it that way. We've had broad stakeholder involvement. We've had the state involved with Medicaid and also the Department of Public Health. We've had providers, doctors, nurses, pharmacists at the table. Payers have been at the table, as well as consumers and policymakers. Just to give you a little bit of a framework as to how we've structured our work, we have an Office of Health IT within the Iowa Department of Public Health that was created as a result of the funding from the state planning effort. We have the Executive Committee, a smaller group of voting members who are approving initiatives. They are really the voting body, the oversight body for our efforts around health IT right now. We have an advisory council, really a group of experts from various disciplines that are providing information and consultation to our executive committee. We have a consumer interest group that was created as a result of the advisory council and the executive committee really recognizing that we probably didn't have a broad enough involvement of consumers in our original efforts, so they're convening consumer work groups across the state to get input from those individuals. And you know, we've had untold number of small work groups working out the details on a number of different of these moving parts for health IT. So we've had just a huge amount of people that have been involved. 85 organizations, over 130 individuals, and I can't say enough about the support that we've gotten from the providers, from the payers, from the whole gamut of individuals who've been involved to date. And the amount of work that we've been able to accomplish in a short period of time has really been a testament to their dedication and their commitment to making sure that we are able to create this health information exchange for the state. That gives you a very busy diagram that, for those folks who are visual, gives you a little bit of an idea as to who all has been involved and some of the relationships between those entities. All right, and so what have we done to date? As a part of the 2008 Healthcare Reform Act, one of the responsibilities that was given to this advisory council executive committee was that we would generate a state plan for health IT. And so we moved forward in creating a plan in 2009. This really came out before we received guidance from the Office of the National Coordinator as to what was going to be expected from that state planning effort that they were going to be funding. So we put together a plan to at least create a framework for what we wanted to accomplish. And then in 2010, once we received guidance from the Office of the National Coordinator, better guidance that helped us to really put some flesh on the bones of that original plan, and met the terms that they wanted us to meet as well, some of the requirements that they had placed in there. We generated a second strategic and operational plan. So really our 2010 plan is the more comprehensive, really builds upon the 2009 effort that we had. The components of that plan: governance, finance, technical infrastructure, legal and policy, and business and technical operations. Governance, we know that the original legislation created this executive committee, but as we look long-term towards what we want to accomplish with creating a health information exchange and having a governing body over that, there is broad recognition that we probably have to change that governance structure. So we've been working on a plan that will help us to frame that out into eventually legislation that you'll see at the bottom. Finance, those grant funds from the federal government are going to go away eventually, and we need to make sure that we have a plan for financing this system because there won't be just an initial build cost, there will be ongoing maintenance costs. And so we're having those discussions right now as to how do we create a sustainable funding stream so that we can maintain this system. Technical infrastructure, this is really the exchange. How do the records go back and forth between providers, and how do we create that network of servers so that that can occur? Legal and policy, there are going to be a number of different legislative changes that need to occur so that providers are protected in sharing that information, and consumers also feel protected that their private health information is being transferred over a secure system. Business and technical operations, again, how are we going to operate this health information exchange on a day-to-day basis? Also, what's going to be expected of those individuals who use the exchange, and what kind of business and technical operations are they going to have in place? Finally, we do anticipate moving forward with legislation this next year. I expect it'll be a fairly lengthy package that'll be very detailed, and we're in the process of writing that now and communicating with legislators as to what that might entail. Finally, I just wanted to leave you with the guiding principles that we've set out, and we just want to highlight the key words, those that are bolded on the screen. Public, private, multi-stakeholder, those have been some key themes that we've had from the outset. Create a sustainable health information exchange, statewide health information exchange. That doesn't preclude regional health information exchanges from starting up, but we want to have a statewide health information exchange. Finally, it needs to focus on priorities of providers. If you don't have those folks who are using it, at least invested in what you're doing and contributing to what you're doing, they aren't going to use it, and they aren't going to be a supporter of it. We've got to make sure the providers understand how the exchange works and how they can use it to benefit their practice. Need to instill confidence in consumers and providers that this is a safe system for transferring information. And finally, we need to build on those smart practices. We know other states that have been involved in this and had success in building information exchanges, and we certainly want to make sure that Iowa is leveraging any expertise that may have occurred or have been generated across the country. So thank you for your time this morning, and David.